And this is my case study for the microbiology case study project, and let's get into it. So, our patient Lily, on August 30th, 2022, at 1:58 a.m., Lily, a 19-year-old college student, began to feel an onset of symptoms after attending a college house party the night before. She has felt progressively tired, experiencing headaches, aches all over, and is sensitive to light. Within an hour, Lily spiked a sudden high fever of 102.5 and begins vomiting, and her roommate decided to take her to the ED due to her declining condition. I do want to take note of a few things here in this situation. Lily is a 19-year-old, which in the bacteria that we will be talking about and that we will be diagnosing Lily with, you'll come to find out that she is a perfect age that is at high risk for getting this particular bacteria. She was also in a setting that this bacteria is transmissible in, such as a college house party. You're picking up cups thinking it's yours and it's someone else's. It can be a very highly transmissible environment for a bacteria such as what we're about to talk about. Upon assessment, the doctor gathered some information that the patient's parents did not vaccinate her as a child. She was sexually active within the last 36 hours, and patient's condition is rapidly declining. So the doctor got a strong inclination due to those symptoms and lack of vaccinations, the duration of the decline, the recent sexual activity, the house party, and just the abnormal symptoms such as stiff neck and sensitivity to light and the onset high fever. Those caused some red flags for the doctor to possibly rule out meningitis. However, that is a big procedure to rule meningitis out. So, what we're going to do is we're going to complete some tests that are a little more simple and that have similar symptoms. Tests like this would be nasal swabbing for COVID, RSV, or influenza. These are easily treatable things, but we also want to look at the white blood cell count and the red blood cell count to assess if she possibly has an infection. In the meantime, she will be admitted for observation and treatment, and then during this time, she, for treatment, will be getting a broad-spectrum antibiotic. Due to this possibility of having meningitis, this is a pretty serious and fast-acting bacteria, so we definitely want to get on top of that treatment-wise, and then hydration for all of the fluids she may have lost during vomiting. Spinal taps collect cerebrospinal fluid, and we're kind of looking at the levels of sugar, protein, and the white blood cell count. So if the sugar level is low and the proteins and white blood cell counts are high, then Lily does in fact have Neisseria meningitis present. So now that we know she has meningitis, we can give her a more specific antibiotic that would be more targeting to the Neisseria meningitis. So antibiotics like this can be ceftriaxone, penicillin, or chloromethylphenidate. So if she does have a penicillin-resistant meningitis, we can always do penicillin G in substitute of that. It is crucial for Lily to isolate during treatment until completed so she doesn't spread it, especially if she is prone to sharing things such as water bottles, food, if she's coughing, that kind of stuff. We don't want it to be spreading. So isolation will be crucial, and observation to make sure she's not worsening. Now, the history of Neisseria meningitis was actually first seen and classified by Gaspard Venezois in 1805, and the first outbreak was shortly after, about 35 years after, in the 1840s in Africa. However, several vaccines have been created over the last few decades, nearly eradicating Neisseria meningitis worldwide. You may be familiar with one of these sets of these vaccinations that we receive as children if your parents decide to get you vaccinated. They're very crucial for prevention, and it's always better to prevent than it is to treat, because you don't have to deal with the symptoms and the repercussions. Meningitis can have long-term effects, so it's just always best to prevent with vaccinations. And these are my references. Thank you guys for going over this case study with me. I always thought it was so interesting how meningitis worked, and it was interesting to look at how vaccinations can prevent them due to them being so contagious. So, thank you guys for watching.